You're listening to a two-part podcast featuring Mitchell Beggs Mosen and hosted by Danny Teese Johnson, talking about the benefits of a regular 715 health check.
I've seen a lot of men, including myself, so we start the 715 health check. We get about halfway through the process and then we don't finish it off.
Yep.
One of the barriers for me personally was the peeing in the jar thing.
Mm-hmm.
So what they do, to test your kidney and your livers and your blood sugars and stuff like that, you need to fast overnight and pee in a jar and take it to the AMS in the morning. That was a barrier for me.
Yep.
It'd come down to pure laziness because I went straight to work instead of going from Roselle to Redfern to work. I just went straight to work.
Yep.
It was just pure laziness, bro. I'll admit it to you right now. It was just absolute laziness. So it took me a little bit to complete my latest 715 because I didn't get around to peeing in the jar overnight.
Yep.
What are some of the little barriers that you're seeing like that? There's little tidbits that men, because we're lazy. We can be lazy us weak. Like we can be.
Look, there's that's definitely one. Is follow-up care.
Yep.
Aboriginal men and Aboriginal people, getting involved with their follow-up care. Going to their first appointment, but maybe not following up with the follow-up care. Some of the other things are, isolation. Some of our mob, they don't live near services that some of us have access to 5 minutes away. It's a whole day trip sort of thing, and that's a really big issue. And having limited services in communities, transport's a big thing for a lot of our mob, especially our elderly. Cost is another big thing. To go see a specialist or it can cost you a couple $100, you know what I mean? And when you're looking after a whole mob and a whole family and all that sort of thing, and you've got to come up with a couple $100, even though you may get some back from Medicare, it can be quite a big thing, So, look, that's a big thing. One of the other big issues too is not a lot of sort of Aboriginal specific services or Aboriginal workers in the industry it's a really big gap at the moment, which we're sort of addressing at the moment and trying to make sure that we've got even if we don't have Aboriginal workers, to make sure that we've got culturally safe practices and environment and workers. So look, there's a number of barriers, but I know for Aboriginal men that follow-up care is a big barrier. It's something we want to sort of make sure that our Aboriginal men are doing, is to all the follow-up care that is involved with health, because you may go in there, have a screen, you may need to come back the next day for results, etc., that they're following up with that. And that's just as important as going in for the initial screen to find out, what the results were of that test. So,
another one. Yep, I've done the 715, but I'm not going to find out what the answers are. Right?
Yeah, that's
I'm feeling all right.
That's it. So, and it's not a new thing as well. Like a lot of the fellas that I've worked with in the past, they may need to see a specialist, or they may be ashamed to sort of talk up and say, hey, look, I can't afford to go see that specialist, so I won't say anything and I just won't go. But there are programs available like the Integrated Team Care program, which works with Aboriginal people with chronic conditions and does have buckets of money there where they can pay for things like specialist appointments, medical transport, medical equipment, and a whole range of things. So we're really trying to promote this in the community and trying to let as many Aboriginal people know, Aboriginal and Torres Strait Islander people know that these programs are available, and don't be ashamed to talk up if you are struggling, financially, transport.
Yeah, and a lot of our mob are, they're on the poverty line. They
absolutely
living away from health services. In the city, we are very lucky that we have access to, there's still isolation in the city, don't get me wrong, but we're very lucky that I live close to a medical service, but not many of our mob do. And the further we get out into the regions, to the remote community, it gets more and more difficult to access those services and complete those checks. Financially, to maintain a good diet can be challenging at times.
Absolutely.
But there is support for that as well.
Yeah.
Is there not?
Yeah, absolutely.
That's a question, bro.
No, definitely. No, there is absolutely. Like, and as I was saying before, like through when you have your 715, you can access, some cheaper allied health visits a year, and part of that is dietitian. You know, so when you go into a dietitian appointment, it's good to be honest with them and say, look, this is what I spend a week on groceries. What can I get for that money to fit? That's healthy and stuff like that. So there are options available, and there's community programs that are available in neighbourhood centres, Aboriginal specific programs, and that can help with these sort of things. And I encourage people to sort of speak up about that, because if they don't, we'll never know that these are issues, so we can't can't address them. So, look, there's heaps of programs available and things that can help out with that, definitely.
Now, let's talk about the costs. Now, we're talking earlier around, costs and programs for specialist services and whatnot.
Yep.
Can you tell us about the bulk billing and what that means and any changes to that? Can we still use our Medicare cards?
Yep.
What's to go with the whole bulk billing when it comes to the 715?
Yeah, look, some of the mob out there, they do have a issue when it comes to cost for services, and seeing a general practitioner sometimes does come at a cost.
Yep. Because, we get everything for free, apparently.
Common myth, isn't it? So there are general practitioners out there and surgeries that do bulk bill.
Yep.
So that is available for mob as well. And what that means is you won't have a fee for service. So instead of walking in there and walking out and the GP saying, oh, that'll be $70,
yep.
Some of our GPs in our community do bulk bill, which means that you will receive it for free.
Yeah, right. Because I've only ever, because I guess the way I was born up and I've been a Moree boy, I've only really ever used AMSs. I've never been to GPs, only a few times. So bulk billing, I guess in my mind, means you just hand over your Medicare card and they take care of the rest.
Yeah.
I don't know. Is that it? Is that what it means?
Well, look, see, when you go to...
Because it might stop. That might be a barrier for mob to go, we'll go to the GP, but they don't bulk bill, or do they bulk bill,
Yeah.
So it could be a barrier.
Yeah, I've actually accompanied people where they tried out a new GP and they walked out and they didn't realise it was a fee for service, and it can be quite shame.
Yeah.
So it's good to, if you are accessing a new surgery, to sort of, ask that question up front. Will this be bulk billed, which means will it be free?
Yep.
Or will it cost me at the end of this, at the end of my consultation, just so there's none of that shame afterwards. You have your consultation, then you've got to come up with a fee.
Yeah.
So I encourage mob to just ask that question before they walk into the surgery, and just
because it's a real fear, isn't it?
Absolutely.
The financial aspects of health and
absolutely, mate. And when you don't prioritise your own health, and you may be a bit tight on money to walk out of a doctor's surgery, and they say, oh, you got to come up with this money, can be quite intrusive and quite shame. So I encourage mob to just ask that question beforehand, and there are bulk billing surgeries available.
So there are barriers out there for our mob accessing services, whether it be specialists, the 715s or whatnot. But there are answers out there if people ask. But
100%.
we've got to be, the health sector's got to be proactive too, doesn't it? And reaching and engaging our mob.
Yeah.
But the mob's also got to...
Yeah, it's a two-way thing, isn't it?
Yeah.
Not just encouraging our community to speak up. It's encouraging our health professionals to be active with referrals,
Mm-hmm.
and, identifying their Aboriginal patients, knowing what's available, and making that journey as smooth as possible for that Aboriginal patient.
Yeah. And I find in our families, it usually just takes one person to start the conversation around health, or getting health checks, or and a lot of our stuff, I know, just reflecting on my own family, a lot of our own health chats have become because of incidents of what happened to our elders. Nen's had a stroke, and that conversation then turns into about, Nen smoked for 40 years.
Yep.
Maybe we shouldn't be smoking and stuff like that. And shout out to my cousin Kelly, she's an ambulance driver out at Moree there, and very difficult job, but she's up every day doing it, and I think she's one of the champions in our family that got us all talking about health. And so if you can find that family member, your cousin, your stepbrother or sister, that's into health, and talk about them, go and talking to them can engage a whole wide family conversation. Do you see that happening where families have a conversation, and then what do you see? What does that then do for the family?
Yeah, look, we when I was working specifically with community, I was an outreach worker, and we'd go in and we'd start off working with one family member, and then before we knew it, we had the whole mob. Oh, that's a great service. Aunt could really benefit from that, or my brother would really benefit from that, and so. Look, it's a definite thing that I've seen in the past, working in the Closing the Gap program, and sometimes it's just about showing, not only that person but that family that it's not a scary thing to go through health, and to make sure that you're screened and all that, and once they see that, brother or sister done it, that breaks down that barrier for people. So yeah, definitely, and don't be afraid to sort of be that person in your mob and sort of say, it may seem like you're nagging at the time, but to sort of say, hey, have you guys had your 715? Have you, do you look after your health? Have you heard about the Aboriginal Health Weight Loss Challenge? Have you,
Well, please be the annoying uncle that constantly says, go and get your 715 down there.
Yeah.
Please be that person.
Go down and get your health checked, because you don't know, like, those little things. And if you know that in your family that, the mob will listen to you sort of thing, you're going to make a big difference in your family and the health of Aboriginal people in general. So, yeah, definitely.
What does the world look like to you, Mitchie? Say we have a rapid increase in 715s over the next 5 years for men, in particular. What would the world look like to you as an Aboriginal health worker?
Yeah, look, we know that our people's health, we have higher chronic condition rates. We have, and alarming rates too. Our people are dying prematurely at a lot younger rates than the wider Australian population. So, look, I would hope that, in the future, if these 715s really kick off and they really become just a thing that everyone does every 9 to 12 months, that our people would be living healthy, long lives, not filled with chronic diseases and, making sure that they live the lifestyle they want to live. And to be able to, one of the big things we drive in the community is when you do sort of, you do get a little bit older, that you're fit enough to play with your grandkids, you're fit enough to play with your kids, and, you're not struck by these chronic conditions and stuff. And, we work with fellas that, didn't maybe look after their health and they regret it now. So I would hope that in the future, if Aboriginal men and Aboriginal women, get these regular health checks, that, like I said, we'd live a healthy, long life, and that our health statistics and our life expectancy rates would be even with that of the rest of Australia.
That'd be a beautiful day, wouldn't it?
Absolutely.
Happen. Now, getting your 715, it's not about looking like the Black Adonis carved from stone. It's not about like you're trying out for Baywatch, running down the beach in your budgies. It's just about feeling physically healthy, and mentally healthy, and looking after our bodies, mind and spirit, isn't it?
Absolutely.
It's not about, being a big bulky fella and Instagramming up. It's just about really taking control of our health, isn't it? It's not a vanity thing.
Quality of life. And that's what these health checks are really for. It's to sort of look at, if you may be suffering a chronic condition or if you're at risk of a chronic condition, and making sure that they treat or plan for the treatment of that. And, so we can make sure that our mob, don't contract these chronic conditions that, at the rates that we are now. So, look, and don't be ashamed to sort of go into your local GP and to speak up and say, hey, look, I want to start living a better lifestyle. I do have chronic conditions that run through my family. I'd like to get a 715 Aboriginal health assessment to make sure that, I don't contract one of these chronic conditions So.
And so, mob, they might be listening to this podcast right now and be going, you know what, I should go and get this done. Where's their first point of contact? Say they want to, Uncle Johnny's out there going, geez, I better go and get this 715 done.
Yep.
I don't know what it is. I don't know what it means. I've just listened to this podcast, but it sounds good.
Yeah.
Where's their first point of contact?
So different communities will be different,
Yep.
but generally speaking, the two main places for it would be their local GP, so their local practitioner, also their AMS. So the AMSs are they're quite productive with these in the community at the moment.
It's not just AMSs that do this. This is your local GP out in the country.
Local GP, yep.
Just your local family doctor, whoever it may be, private.
Absolutely.
They do the 715s.
Absolutely. That may not be advertised in the surgery, but that's why we encourage mob to sort of, go up to their GP and say, hey, look, I've heard about this 715. I'd be really interested to sort of have one of these and, to start that conversation with their GP. And then what that might do is that might get that GP thinking, oh, yeah, okay, I might start doing this with all my Aboriginal patients, So, generally speaking, all GP practices and AMSs will do your 715s.
And we have some beautiful pamphlets that are out across AMSs and GPs. Can you talk us through some of these pamphlets? Because they're just newly released, I believe, aren't they?
Yeah.
Which are a great resource for our mob. and for you mob out there, and I do this for some of my family members, if you cannot read and write, there is no shame in that. From some of my family members, I sit beside them, I read out the pamphlets and stuff like that. So if you do have an issue with literacy and numeracy, please reach out, because I know a couple of my family members who can't read and write, and they make out they're reading but being gammon at the same time. So I'll sit there and read it to them so they understand. But can you tell us about these brochures, one for health professionals and one for patients? Can you just tell us a bit about them?
Yeah, so the mob at 33 Creative designed these ones, and they took them out to community to see what the community's opinion on these were, and they were very positively received by community. And basically what it is, it's for all your mob that can't see it at the moment, it's a brochure, and it's got the Aboriginal artwork with some Aboriginal people on the front, a GP on the front on the GP one, and it's basically just running through what the the 715 may be, how to ask the question, who's eligible, what they may do in the 715, about identification in the surgery, etc. But the beauty of these little brochures is when you walk into a surgery, sometimes the first thing you notice is that blackfella artwork on the wall or in the brochure stand, and our community will really grab at that and sort of say, hey, like, what's this here, So, and I think, they got local artists to do the artwork, which is, it's got an explanation on the back of the art. But keep your eyes out. They are, got a purpley tinge to them, and there is both for the patient and also the health professional. So we're trying to, as a PHN, really promote these, not only in the community, but in the doctor's surgeries, to encourage that conversation of having a 715 and the importance of it, identification in general practice. So, shout out to the team at 33 Creative.
Put it all together there, but it's handy info for our mob. Do read these pamphlets, and because they do give you the proper info, and they really do explain sort of, the questions that you don't want to ask. Sometimes we don't want to ask the silly questions because we don't want to look silly.
Yep.
For you, Mitch, what's some of the tips to staying strong and healthy and living a healthy life? Like, we don't have to be absolute freaks about it, do we?
No.
Like we don't have to be. I don't. No, I won't. I won't go. But no, we don't have to be. Addicted to a healthy lifestyle. Yep. We can still live a healthy and fun lifestyle. We just have to have an imbalance, don't we? But what's some of your tips for staying strong, healthy, and active?
Yeah, look, some of the things that obviously we encourage is to encourage mob to have their yearly 715. Mm-hmm. It's a good place to start. Your GP can sort of go through some of the things that you may be lacking in your life if you do have high blood pressure. If you are struggling with mental health, etc., because these can be barriers to starting a healthy lifestyle.
Yep.
So one of the big things for me would be encourage all mob to have a 715 Aboriginal health assessment. Some of the things that you can do in your everyday life is, look at some of the programs that are available in your community. I know in our Western Sydney community, we've got over 70 mob that participate in the Aboriginal Knockout Weight Loss Challenge, and it's created like a hub of mob support, weight loss, better lifestyle, just that social inclusion and all sorts of things. So
because fitness is becoming cool again.
Absolutely, brother.
We've seen the last 5 years, like fitness is starting to become cool again. Never used to be.
Yeah, look, it's and not only is it good for your physical health, it's good for your mental health.
Yep.
I know that I go down there every afternoon, down to my gym, and sometimes I may not even lift weight. I just yarn with people, and it's really healing for me because whatever stresses or whatever things I've gone through in that day, it's sort of a release point for me.
Yep.
So getting involved in some of the local programs, looking at your 715s on the yearly uptake, and finding a GP that you have trust with. Also, encouraging other mob to participate in these things as well. Not just yourself, but getting your daughter, your son, your brother, whatever it may be, and saying, hey, look, I've made this lifestyle change. I'd like for you to as well, etc. So encouraging other mob, and dietary and all that sort of thing.
It is important to drag your brothers along to events.
Absolutely.
I got bought into the healthy weight loss challenge thing.
Yeah.
And I was like, I don't need to lose weight. I'm a skinny little fella. And I was like, yeah, but you unhealthy, bruh.
Yeah.
You need this, you need this. And I got dragged along to it by my mates because, they recognised that I was, I was unhealthy, and
Yeah.
and good brothers do that.
Yeah.
They'll drag you along. It's like, I don't care, you come in with us. So
We know.
I'm glad they did. I felt so much better after it.
I know that at Berbaga Barora, the Western Sydney team, our goal wasn't to win the health challenge. It was just to help people to to change their lifestyle and to have an environment where they came and felt safe, and they could feel inclusive into something, and also to help their physical and mental health. And sometimes we'd start off with a certain amount of people, and then all of a sudden the sisters come, and the whole mob was coming, because that word of mouth, just sort of promoting that to the other mob, and saying, hey, that wasn't actually that bad. And like you said, bro, we had people there that their goal wasn't to lose weight, it was just to get a healthier lifestyle, and that may be what it may be for some people. Like, it's not always about sort of losing weight, it's sometimes just about a healthier lifestyle.
Yep, totally mental health related. Using exercise to address your mental health issues is something I do all the time. It's,
absolutely,
like you said, it's better than drinking a couple of glasses of wine each night. If you go and do some exercise or do something like that, you feel amazing.
Yeah, it sets your goals too. Like at the end of an 8-week program or whatever it may be, that I not only want to achieve this, but I want to make sure it's a lifestyle change, that I don't just do it for that 8 weeks, that I can live a healthy, happy lifestyle, and to make sure that I'm around for as long as I can be, and that it's not you're not stricken down with chronic disease and poor lifestyle. So yeah.
What's the best advice that you've given to someone in terms of health that's really resonated and really cut through? Now, we're talking about young fellas here and men. What's something that you've said that really that's cut through?
Yeah, look, I actually think that, when you go to the gym, when you do all these sorts of things, you've got to learn to enjoy it. One of the things is, you can get motivated for a gym for a couple of weeks because you want to look great, you want to get fitter and all that, but you've got to learn to try and enjoy that process. Not just focus on the end goal, enjoy the journey. That starts with your everyday things that you do in life, your eating, your exercise, the things that, if you can walk to work, if it's only and you're driving, just changing those little habits, but enjoy the process of it, because that's how you'll change a lifestyle, not just a short-term period. So that's what I try and encourage with all the young fellas that I train at the gym, is to say, enjoy this process. The rewards will come, but you've got to enjoy the process. So, that's one of my big things that I try and promote.
Yeah, and that's really good advice to wrap it up on. For me, I think what got me back into health again at the tender age of 43, I think it was I had a black fella who runs a health program encourage me, not preach at me to get fit and get healthy and be active. And I think that's really important, the way that we engage with our mob, rather than preaching and telling them, but maybe encouraging is a really good way to get fellas back into health and doing their 715s. And we just can't emphasise enough how important this is. Take for someone who's lived their life like Luna Park when they're in their 20s, who's now 44 and has to address some issues to get his health back on track. But it's never too late to get your 715, and it's never too early to get your 715, is it, brother?
Absolutely, brother. And, it's not shame. There's nothing shame in yarning about your health. And, at the end of the day, we want to see our mob grow healthy, strong, happy lives. And, it can all start with a simple health check. And, please promote it and, lead by example and have your 715.
Yep. That's it. If you're going to talk the talk, walk the walk, make sure you go to www.health.gov.au/715-health-check. You can find out all the info there. If you've got young mob in your family, they'll get on the net for you. Their grandpa, your old chilpies, and they can show the way to get access to services. Mitch, just lastly from you, what's your last bit of advice, information, just your last comment on the 715 that you'd like to say to our mob?
Yeah, look, I want to encourage as many mob as possible to have the 715. They roughly take about 45 to an hour. It's not a lot of time out of your year, but it can have massive results to not only your health now, but your health in future. And it's accessible. So please speak up and encourage all mob to have a 715 when best convenient to them.
Yeah. Well said, Mitch. We'll leave it there. I'm Danny Teese Johnson. Thank you for listening to this important podcast about the 715, and to our brother Mitch Beggs Mosen. Thanks for sharing your stories and for your information. And please, you mob out there, get in touch with your local GP and your local AMS for further information.
Thanks, Danny, brother.
You've been listening to a podcast talking about the benefits of 715 Health Check. For more information, visit health.gov.au/715-health-check. Your health is in your hands.